Greetings to everyone. The topic of our video today pertains to a groundbreaking bone marrow transplant that promises to vanquish sickle cell disease, unveiled through a meticulous study spotlighted in the New England Journal of Medicine Evidence on February 25, 2025. This innovative reduced-intensity haploidentical bone marrow transplantation, spearheaded by luminaries at the Johns Hopkins Kimmel Cancer Center, alongside a constellation of 20 US and London-based cancer hubs, emerges as a beacon of hope. Safe, curative, and far more affordable than the heralded gene therapies. With a staggering 95% survival rate 2 years post-transplant and 88% of adults liberated from sickle cell's cruel grip, this procedure shatters myths of needing a perfect donor match or fearing dire graft versus host perils. Without further delay, let us delve into our discussion. Imagine a beacon of hope piercing the shadows of sickle cell disease, a ruthless blood disorder where red blood cells twist into crescent moons, snarling blood vessels and tormenting roughly 100,000 Americans, predominantly black individuals, as the Centers for Disease Control and Prevention solemnly reports. Could a novel bone marrow transplant, forged by brilliant minds at the Johns Hopkins Kimmel Cancer Center, truly obliterate this agony? A Phase 2 trial unfolding from 2017 to 2021 across 19 US centers and London roars an affirmative, its findings crystallized in the February 25, 2025 edition of the New England Journal of Medicine Evidence. Behold the marvel of reduced-intensity haploidentical bone marrow transplantation. In this dance of life, bone marrow, harvested from a half-matched donor like a parent, sibling, child, niece, nephew, aunt, uncle, or cousin, melds with the patient's body. Why half-matched? Because the proteins orchestrating the immune system's symphony, sprinkled across the donor's marrow cells, must harmonize with at least half of those in the recipient's cells. Otherwise, these cells might wage war on their new host, igniting graft versus host disease, a specter this procedure tames with cunning. Before this transformative union, patients brave low doses of chemotherapy, gentle yet potent, coupled with total body irradiation, a radiant purge preparing their bodies. Post-transplant, cyclophosphamide storms in, a valiant drug-quelling graft versus host disease, alongside mycophenolate mofetil and sirolimus, guardians for up to 1 year. Of the 42 souls with severe sickle cell disease who embraced this trial, 95% stood alive 2 years later, their spirits buoyant. 88% now walk free of disease's cruel grasp, unmarred by its events. Yet shadows linger. 3 faced graft failure, 22% battled moderate to severe graft versus host disease, and 2 slipped away within the first year, 1 felled by COVID-19's merciless grip. How does this triumph compare to gene therapy's lofty promises? Our results with allogeneic transplant rival, or surpass, gene therapy's gleam, declares Richard Jones, MD, a titan of oncology, steering the bone marrow transplantation program and hematologic malignancies at the Kimmel Cancer Center. Most adults, Jones asserts, can embrace this transplant, a fraction of gene therapy's staggering $2 million to $3 million cost, dwarfing the transplant's roughly $467,747 price tag. Many, perhaps most adults, shudder from gene therapy's demand for high-dose chemotherapy, a burden too heavy for those with ravaged organs, he warns. Gene therapy's risks, Jones cautions, may unleash long-term organ damage and leukemia's dark shadow. Stark contrast to this transplant's gentler path. Is transplantation's tale one of myth or reality? A common fallacy whispers that sickle cell cures demand a flawless donor match, courting severe graft versus host disease and high mortality's grim reaper. Yet this trial, echoed by others, shatters that illusion, as Robert Brodsky, MD, the Johns Hopkins Family Professor of Medicine and Oncology and Hematology's Sentinel proclaims, "Transplantation whispers a far thriftier song for hospitals and patients alike," Brodsky exclaims. Picture this. Transplant patients linger in hospital confines for a mere 8 days, not the 6 to 8 weeks gene therapy demands. Transfusions too shrink dramatically, 50 median for gene therapy versus a scant 6 post-transplant, mostly in outpatient ease. This clinical odyssey, supported by the Blood and Marrow Transplant Clinical Trials Network, the National Institutes of Health, the National Heart, Lung and Blood Institute, and the National Cancer Institute, via grants U10HL069294 and U24HL138660, drew 54 eligible participants, 42 of whom received this lifeline. Their median age, 22 years. Demographics, 59% male, 92% black, 4% Hispanic. Follow-up stretched 37 months on average, with serious side effects rare, yet poignant. Alongside Johns Hopkins, luminaries like Vanderbilt University Medical Center in Nashville, Tennessee, University of California, San Francisco, Medical College of Wisconsin in Milwaukee, and others, spanning Atlanta to London, joined this crusade. Additional voices from the EMS Company in Rockville, Maryland, and the National Heart, Lung and Blood Institute enriched this tapestry. A companion paper, co-authored by Jones and Brodsky, graces the February 25, 2025 issue of Blood Advances, comparing allogeneic bone marrow transplants to gene therapy's lofty perch. Early whispers of this triumph echoed at the American Society of Hematology's annual meeting in December 2023, igniting hope's wildfire. How does this transplant not only heal but also reshape sickle cell's brutal narrative? Stay tuned as we unravel its profound promise. To support our channel's growth and ensure broader awareness, kindly hit the like, share and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.